Amidst the devastating HIV/AIDS pandemic of the 2000s, Eswatini's healthcare system was overwhelmed. According to UNAIDS and the World Health Organization WHO figures, with 25% of the adult population infected and limited access to treatment, it was a public health crisis of staggering proportions. Seeing the urgent need for healthcare in rural Eswatini, Echo and Harry VanderWal from Ohio in the United States launched the Luke Commission TLC. Funded by the United States government through the President's Plan for AIDS Relief, PEPFAR, the United States Agency for International Development, USAID, and the Free Wheelchair Mission, TLC provides free, high-quality critical health services to over 300,000 impoverished and disadvantaged patients annually, transforming lives and communities in rural Eswatini. Sibusiso Hlophe is one of the many whose life was transformed by TLC. For years, he suffered from chronic hip pain that limited his mobility and his life.
I've been referring the life that I used to live, and I've been seeing my friends elevating, in life they're progressing. And I felt left behind. I was very excited to get a call from you, from TLC, that we've got a solution for your problem. Doing hip replacement, it's a very expensive surgery. Knowing that I wouldn't pay even a cent. I was so excited.
Sibusiso's story is just one of hundreds of thousands of lives touched by TLC. According to the National Institutes of Health, NIH, Eswatini's healthcare system currently faces immense challenges with a shortage of doctors and nurses, leaving many without access to healthcare. But for those like elderly patient Gabriel Shiba, who find their way to TLC, hope arrives in the form of free, comprehensive and compassionate health care.
You go to other hospitals, they'll tell you, we are still calling a doctor, let's wait. We've lost many lives there. But here there's a doctor every day. You can even cry sometimes here. Where you found being washed in the morning with hot water. It is only my mom who last washed me, and my wife.
Arriving in Eswatini during the height of the HIV epidemic in 2004, the VanderWals saw firsthand the desperate need for quality healthcare in rural communities. Despite facing the challenges of an unknown environment, they were determined to understand those challenges and the complexities of rural healthcare and find ways to bring compassionate, effective solutions to those most in need. The American couple focused on developing a strategy that brought compassionate, impactful care directly to the most isolated and underserved people of Eswatini. The Luke Commission currently provides outpatient, inpatient, surgical, emergency, and critical care at the ever-expanding Miracle Campus in central Eswatini. Starting each day from the Miracle Campus, the TLC team, consisting of over 700 US-born and local staff, delivers outpatient care through more than 100 mobile hospital outreaches each year across Eswatini.
As Westerners coming in, sometimes we think that we have all the answers and we think that we can somehow, if we do this and that, we can fix the situation. But our team helped us understand the situation was far more complex, and so we just sat back and listened for the first several years and just got to know the rural people, got to know the challenges that they faced, the challenges of reaching the health centers, the day-to-day challenges that they struggled with. And so with that mindset, we were able to, with our team, develop a strategy to try to reach these rural communities and bring healthcare to them, not expecting them to come to us, but us to figure out how to bring healthcare to them.
TLC's supply chain strategy involves bringing mobile healthcare services to communities and establishing a reliable supply chain management system that includes sourcing medical supplies, maintaining inventory, and transporting supplies to different locations in a timely and efficient manner.
We recognized that while people may be able to board the bus and pay bus fare and they may be able to pay the fees at the health facilities, where they were really struggling is when they had to go to the pharmacy to buy medications. And we didn't want this broken link. So we worked very hard behind the scenes to develop a robust supply chain system that would ensure that all of the supply chain challenges were managed by us.
In a world where healthcare access is often an afterthought, the VanderWal couple are a living proof that kindness and ingenuity can be the most powerful medicine of all. Nokukhanya Musi, VOA News, Stvogoto, Eswatini.